managers that they're running a business. They have business targets and business outcomes, and we want to deliver care.
Do you know there is not one mental health bed within the M25 area that's vacant, and if somebody needs it, they kick somebody out of it. That's happening in mental health, it's happening in mainstream health, and we have to remember mental health. This affects all of us, it's our health service. It's the jobs of the health workers, it's our health service, we're all in this together.
To be here with lots of other friends, but also particularly the Whittington Hospital campaign. Like others across London, we fought off the closure of our accident emergency department, but we're now faced with the sale of a quarter of the site for £17 million and 500 job losses in order to slim the whole thing down to make it into a foundation trust. Well, our answer is no. Our answer is that we want and value our local district general hospital, and we will campaign to defend it, just like in South London, just like in West London, just like Chase Farm, just like all over London.
To see all of the different campaign groups, as well as health workers, as well as people across London who care about the NHS coming together in London. And yes, we want a national demonstration as well to show how much we care about defending our NHS. And to send a very clear message that our A&E departments are not available for property developers. That our maternity units are not for downgrading. That our health services are a public service, not a private business opportunity. And that our NHS is not for sale.
These horror stories that come out of the NHS, they are being used as an NHS bashing exercise. The fault lies not with the NHS, but with what governments over the last 20 and 30 years have been doing to it.
The NHS will last as long as there are folk left with the faith to fight for it. These aren't my words, these are the words of Bevan. And you are the good people of London who are fighting for the NHS. You have the faith. I have worked at the NHS for 25 years, not to see it dismantled, broken down by the Tory government. This is our NHS, your NHS of the workers and the people's country. We will not let them get away with this. We will not let it be dismantled.
Save Lewisham Hospital! Save the NHS! Save Charing Cross Hospital! Save the NHS! Save Hammersmith Hospital! Save the NHS! Save Ealing Hospital! Save the NHS! Save Kingston Hospital! Save the NHS! Save Whittington Hospital! Save the NHS!
The local campaigns are like our hearts and lungs and blood and arms and legs. They need to be strong, but then they need to come together like this. And what we really need is a national demonstration, because what that will do, it will forge even closer and stronger links between all the campaigns and movements across the country. And we need to have some leadership. We need the trade union movement, and we need the Labour Party, quite frankly, to come out and actually to state their support, not only for such a national demonstration, but to commit themselves, to commit to repealing the Health and Social Care Act, to getting rid of PFI and to reversing all these cuts. That's what we need. And that's what we need to work on over the next few months. Thank you.